everybody. My name is Emily Sebald. I'm a licensed clinical social worker and I am a mental health therapist in California. So I'm here to talk with you today about mental health and why it is important. So who am I and why are you hearing from me? I was actually a graduate of Brawley Union High School, and I was in the seats that you guys are in now, not literally, because I'm assuming you guys are at home and not in the classroom. But I believe I was in Miss MacKenzie's English class for both my junior and my senior year of high school. And so she approached me and asked me if I might be willing to talk with you all about mental health and why it's important. So that's kind of why I'm here. So I'll just give you a little bit of background information about kind of how I got to this point in my career and in my life. So after high school, I went to San Diego State and I did a 4-year degree, and I got my bachelor's degree, and then immediately after that I did my master's degree in social work at the same school. So all in all, that was 6 years of college, and I can tell you I never ever in a million years thought I would be the type of person to get a second degree after already spending 4 years in school, because I never was like a super studious person. Like, school didn't come easy for me. But here I am, and I did do those 6 years because I needed to do what I want to do, which is what I'm doing now. So after college, after my master's degree, I worked for about 2.5 or 3 years in outpatient mental health settings for the county of San Diego. And during that time, I got a lot of experience and I accumulated enough hours to sit for an exam, which I passed, thankfully, about 2 years ago, and allows me now to call myself a licensed clinical social worker. And I can work independently, basically, is what that allows me to do. It allows me to have my own private practice, which I am doing now on the side. So I do that, and then I also work in a hospital as a behavioral health consultant, and I do that full time. So that's kind of a little bit about me. Before I kind of jump into the topic of mental health, I just wanted to talk with you guys a little bit about how important it is that we talk about this. So especially now with this pandemic going on, we're in very strange times. Nobody in this world has gone through something like this pandemic. Yes, there was a pandemic with the Spanish flu lots and lots of years ago, but the way things are now, it's just completely unique. No one in our lifetime has had this experience. So I know I've heard from a lot of people, it's just really thrown us all through a loop. And I know in my job at the hospital, I've been seeing a very high increase in people coming in with anxiety and depressive symptoms, people coming in and kind of describing just not feeling like themselves or just feeling off. It's just been, I think, hard on a lot of people. And so I want you to know that, because you're not alone. If you've also been feeling off, or you feel like, gosh, like, why is it so hard for me to manage my stress? Like, I've never had this problem before. I'm seeing that a lot of it has to do with just the way that we interact with people has changed, which affects us. And also a lot of the things that maybe some of us used to do that helped us to manage our stress, we're not able to do anymore. So it's just made it really difficult, I think. So just know you're not alone. I think a lot of people are feeling this way right now, myself included. I've gone through my own COVID mood changes as well. I think we all have. So let's talk about mental health. What is it? So mental health is your social, emotional, and psychological well-being. Good mental health allows us to concentrate, to complete tasks, to experience happiness, to control our impulses. So for example, if you're feeling angry and you're having the urge to punch a wall or to yell at your mom or dad or friend, good mental health would allow you to control that urge and stop yourself from doing that, and know that that wouldn't get you what you wanted from the situation. So that's kind of some of the things. It also allows us to understand our emotions in general and act thoughtfully. So things you may notice if maybe your mental health is declining or your mental health is suffering would be decreasing the amount of time you're spending with friends and family, and not because you're busy, but because maybe you just don't feel up to doing it. That would be one sign. Another one would be falling behind in school. So, and it doesn't have to be like falling behind in school, like you're going from an A to an F. It could be very gradual, like maybe you're getting a C on a test when normally you would get a B. So just, it could be a very slight change, but you're not necessarily performing at your greatest capability. So that could be a sign. Maybe if you're having difficulty enjoying things, like if you really enjoy watching football, for example, and now when you watch football, you're just kind of like, I don't really enjoy it anymore. Or maybe you really enjoy exercising and now you're like not motivated to exercise, or when you do exercise, you just feel like you just don't really care about it. It's just not giving you that same boost in energy and positive feeling that maybe you usually get. And then maybe sleeping has changed for you. So sleeping is a big indicator of mental health in general. And if you're sleeping too much or not enough, that's going to impact your mental health negatively, but also it can be a sign that your mental health is declining. And I don't mean like sleeping too much, like you're sleeping till noon because you stayed up till 2 a.m. I don't mean that. I mean, maybe you're not falling asleep till 2 a.m. and then you don't sleep the whole night, or maybe you are having difficulty falling asleep because you're worrying so much at night. So that's kind of what I mean. And just kind of to give you a frame of reference of how much you should be sleeping, teenagers need between 8 and 10 hours of sleep per night usually. So if you're sleeping like, 14 hours a day, that might be a little too much. And if you're sleeping less than 8 hours, that might not be enough. So just to kind of give you a frame of reference. And then I thought this statistic was interesting, so I wanted to share it with you. The National Alliance for Mental Illness, NAMI, they have some resources available, so I looked into them, and they actually have the statistic that one in 5 people between the ages of 13 and 18, which is where you all fall, suffer from mental illness. So that's a lot. If you think about it, in a class of 30 people, that would be 6 people. So I just wanted to share that because I think a lot of times we think mental health doesn't exist, or we're struggling with mental health and we think we're the only one, and it's actually a lot more common than you think. In your lifetime, I'm sure you will run into either a family member or a friend's family member, a classmate, or a friend who at some point in their life has struggled with mental illness, whether it's diagnosed or not. So I wanted to talk about some of the more common diagnoses that I usually see, which are usually anxiety and depression. Those are probably the most common. It's not the only ones, but those are the most common. So we're going to go through those. So the first one we'll talk about is depression. So there's a difference between feeling sad and depressed and actually having a depressive disorder. The first thing is, if you have a depressive disorder, that has to be diagnosed by either a mental health professional like a psychologist, psychiatrist, licensed social worker, or a primary care doctor. So like the doctor you go see when you're feeling sick. So those are the people who can diagnose. So that they would have to diagnose that for you to have that. You may have a depressive disorder and it's undiagnosed as well, though. So that's definitely worth mentioning. So the main difference, though, is you can have a lot of symptoms of depression, but if they're not persistent, like they don't happen over a certain period of time and they're not impairing your functioning, that would make it not a depressive disorder. So impairing your functioning would be like it's impairing you in some way in your life. So maybe you can't perform in school, so you're failing, or maybe you're not socializing at all, so it's impairing your functioning in the social aspect of your life. So those would be just some examples of that. The common symptoms of depression are feeling sad, of course, feeling hopeless. So you would know someone was feeling hopeless if they were making statements like, well, what's the point? Or I shouldn't even try because I know it's going to go badly. So feeling hopeless shows that like they don't think things are going to get better for them. Also, maybe being easily annoyed. So irritability is really common, especially with teenagers. So, we all get annoyed, but if it's like all the time about everything, and maybe even things that maybe don't warrant getting annoyed easily with, that would be a sign. Loss of interest or enjoyment in things that you normally enjoy. We kind of talked about that earlier. Loss of appetite or overeating, so weight loss or weight gain. Sleeping too much or not sleeping enough. Negative self-talk, so making statements to themselves about oh, I got a B instead of an A on this test, I suck, or I must be stupid, or those types of things. So just being really down on yourself, about yourself. Poor concentration, difficulty functioning normally, like we just talked about. And then the last thing is a more serious thing, suicidal ideations, which means thinking about not wanting to be alive. So that could be, just like thoughts like, I wish I could die, or I want to go to sleep and not wake up, or it could be more serious than that, which I won't go into, but if you have more questions specifically about suicidal ideations or anything related to that topic, feel free to let your teacher know or send her a question and she can get that to me and I'll be happy to answer that for you. So now let's talk about anxiety. So what is the point of anxiety? We have anxiety because anxiety is a survival instinct. It helps us to be motivated to keep ourselves safe in very dangerous situations. And it also helps us to be motivated to do the things we need to do every day. So we need a little bit of anxiety in order to be motivated to study for a test or to be motivated to even get on our Zoom call every day. So we do need those low levels of anxiety, but the high levels of anxiety we want to only occur when we're in some type of danger and we need to act quickly without thinking. So if you're in the woods and you hear a bear, you want your fight or flight response to be activated so you can act very quickly and keep yourself safe. Now, you don't want your high levels of anxiety to be occurring whenever you are, like, for example, trying to study for a test, because then likely you wouldn't be able to concentrate enough to study, and then you would probably not do well on the test. So we want low levels of anxiety that are manageable, that help motivate us, and we want to save the high levels of anxiety for just whenever we're in a situation where we are in danger. So what do we want to look for with anxiety? Again, same thing with depression. You can feel anxious frequently, and you could still not have an anxiety disorder. You would want to be evaluated if you were concerned about potentially having an anxiety disorder. And it would need to be impairing your functioning, right, for you to have that disorder. But what we want to look for are like constant worry and then like difficulty controlling the worry, unrealistic fears, nervousness or restlessness, or just like that feeling on edge. So someone who feels on edge all the time might feel like shaky or might need to like pace around a lot, or might just feel just like that on edge feeling. There's a lot of physical symptoms that can occur with anxiety as well, like stomach aches, headaches, that type of thing. Of course, those things can happen for other reasons too. So they only indicate anxiety if they're in conjunction with some of these other symptoms that I'm describing. Some that it has in common with depression are low energy, poor concentration, difficulty sleeping, changes in eating habits. Those would all be things that can indicate anxiety, but are also symptoms of depression. And then avoidance of whatever is making you feel nervous or anxious. And then also just like muscle tension, so just feeling tense in your body. So how do we maintain good mental health? Good mental health is maintained a couple different ways, but let's start with the first one, which is keeping positive relationships with friends and family. So we're social beings. As human beings, we are very social. We need relationships to help us to feel purpose and to feel belonging. We need those things. With that being said, I want to emphasize the positive So if you're in a relationship that makes you feel bad about yourself or feel bad in general or makes you feel afraid, those would not be relationships that are going to help you with your mental health. They'll actually do the opposite. Poor relationships can actually reduce your mental health and well-being. So you want to make sure the relationships you do have are positive ones. Engaging in self-care, and that looks different for everybody. So self-care can be, for me, like it's walking my dog every day, drinking my coffee, and exercising. Those are the things that I do for self-care. Also spending time with my family. Forgot about that one. But those are the things I do for myself that make me happy and help me to feel like I'm taking care of myself. There's also more basic self-care like taking a shower, cooking, making sure you're eating enough. Those are self-care too. So there's basic levels of self-care, and then there's more specific ones for each person. So finding whatever that is for you. Having a balanced diet is also important. So, we don't want to be eating like fast food every day or fried food every day, because that can definitely impact our mental health and how we feel about ourselves in general. Managing your stress. So if you have something that comes up for you, like if you had to move houses, or if maybe you had like a family member or a friend move away, those would be stressors, and those would be things you would want to manage and talk about. However you do that for yourself is up to you, but managing that stressor so it doesn't cause further symptoms. Expressing yourself, so sharing how you feel with other people is really important. It kind of takes a weight off of you when you're able to share something with someone that you're feeling. So that's really important. And then also finding your purpose and sticking to your values, which I know this one's a little bit harder at your age, because you're almost adults, but not quite, and you're trying to figure out who you are separate from your family, which can be a confusing time. But identifying like what's important to you, and really trying to stick to whatever your values are. So like a value for me is family. So by sticking to that, I stick to that value by spending time with my family. If I can't spend time with them, I reach out to them to see how they're doing. I do things for my family to make sure that they're okay and that I'm helping them. So that's kind of one way that I stick to that value. But there's a lot of values. So if you don't know what yours are, that would be a good thing to try to figure out. So also some common coping skills that I recommend to people, and this is not an exhaustive list by any means, but these are just a few things that I think can be helpful if you're struggling. Exercise. So exercise, actually a lot of research has shown, can be very helpful in improving your mood, whether it's anxiety, depression, whatever. But in general, it releases positive hormones in your body that can help improve your mood. So that's really helpful. Up to 30 minutes a day is recommended. And exercise doesn't have to be like you're going to the gym and like pumping iron for 30 minutes. It can be a walk. It could be a run. It could be lifting weights, but it could also be something very simple. Just trying to stay active. Journaling is another helpful way to kind of express yourself if you don't feel comfortable talking. Sometimes writing things out can be helpful. Deep breathing and progressive muscle relaxation, those are both coping skills that I teach. Maintaining a schedule in general can help to cope with any stressors you're having. So just knowing what to expect next helps us to feel more in control, which can lead to reduction in mental health symptoms. So I think that's why, like with COVID, everyone has been kind of thrown through a loop a little bit, because our schedules and our routines and like how things normally are has changed. So finding a new way to do things or a new routine, a new schedule can be really helpful for that. And then also just creating small goals for yourself. When we say we're going to do something and then we actually do it, or we're working towards it, that helps us to feel good about ourselves and to kind of improve our self-esteem. So those are all kind of common ways that I usually advise people to maintain their good mental health. So what is therapy? So therapy, I think a lot of people have this expectation with therapy that you go to therapy, the therapist like waves their magic wand and everything's good after that. But therapy is hard. You have to put in a lot of hard work and talk about a lot of uncomfortable things to make progress. And I think it is very rewarding if you are able to do that. But there is no like laying on a couch, closing your eyes and having the therapist there taking notes very intensely. That's not what therapy looks like. Usually you're sitting kind of like looking at each other how I'm looking into the video right now. Usually it looks more like this than it does what I just described. So the reality is you can do it online or in person. Online is very popular right now because of COVID, but you can also do it in person. And usually you start with an assessment where the therapist just asks you questions about like, what are your symptoms? Why are those symptoms a problem? How is it impacting you in your life? And then the therapist might ask some questions about like family history and you're like how your upbringing was, things like that, just to kind of understand what the problem is and how they can best help you. After that, you kind of work together collaboratively and you create a plan and goals for treatment. And then after that, it's weekly or bi-weekly for some people therapy where you gain insight into your problem to better understand what's going on. You might learn coping skills like some of the ones I just mentioned. And then you also work on building up your support network so that once you've kind of gone through therapy and you've made progress, you have people to support you so that hopefully you won't need therapy again and you'll have that support within your community. If you do find that someone you know or care about is struggling with mental health issues or you suspect they are, there are some things you can do to help. So the first thing is listening without trying to solve the problem. So one of the things I think maybe we've all experienced at one time is like we're, telling someone like, for example, I can remember when I was a teenager, like telling my mom how sad I was about like a boyfriend breaking up with me or something. And immediately like maybe she's like trying to shoot out solutions like, well, why don't we go for a walk? Or, well, why don't you just work towards, being better at basketball? Or, let's go make cookies. And immediately was kind of going towards solutions, which she was trying to help. She wasn't trying to, make things worse by any means. And she didn't make things worse, but I didn't feel validated in that moment. I didn't feel like she was really listening to me. I felt like she was just trying to get me to stop crying or being upset about whatever I was upset about. So listening and just kind of reflecting back what the person says often makes them feel more validated and listened to. Like they feel like you really care when you're able to like repeat back what they've said to you. And so trying not to solve the problem initially, unless they ask you, like, what should I do? Then you could, shout out some different solutions. But normally you want to just reflect back and give them that opportunity to share and just like vent basically. You can help them find additional support if needed. So like if, for example, someone was saying that they didn't want to be alive anymore, that would be a good time to reach out for some help and get them additional support, calling up a parent or I'll give you a few other resources here in a few minutes. Also checking in with them more frequently and just inviting them to do stuff more often. People who are anxious and depressed, most often I hear they say that they feel like a burden or like they're bothering people. Like they don't want to bug them or put their problems to be someone else's problem too. So by reaching out and giving them that opportunity to share with you, that's really helpful because it's not requiring them to reach out and in their mind being a burden. You kind of take that away and it makes them feel cared for and like they're not a burden as much. So that's a really helpful thing to do. You can ask them if there's anything you can do to help. So not like offering things that you think would help, but maybe saying, well, what can I do to help you, if anything? And sometimes there might be something specific, or it might just be, well, talking to you is helping, and sometimes that's enough. And then the last thing I just like to mention is like, remember that if they aren't reaching out to you, if your friend isn't reaching out to you, or maybe your sister or your brother, it may not be that they don't want to talk with you. It may be that they're just going through something. So reaching out is always helpful, because it's usually when someone's not reaching out to you, not always, but most of the time it's not about you, and it's more about whatever it is that they're going through. So just kind of remember that. So the resources I wanted to tell you about, so there's some suicide prevention resources. One is called the National Suicide Prevention Hotline. The number is 800-273-8255. And that's a hotline that someone can call 24/7, so 24 hours a day, 7 days a week. And they can talk with someone if they are having some of those thoughts about not wanting to be here. That is not a crisis line, though. So if someone was telling you something alarming, like that they were going to hurt themselves, you wouldn't want to direct them to that. That would be more so if they've just thought about it in the past. If someone does say they want to hurt themselves, you would want to direct them to the nearest ER to be evaluated, or you would want to just call 911 if you couldn't get them to the nearest ER. And then the other resources I wanted to talk with you about are just some general resources that I think are helpful. The first one, the first three actually are a few different apps that you can download. So I like apps. I hope you all like apps too. I think they're helpful. So the first one is COVID Coach. That one has a ton of different coping skills that you can use to manage anxiety, stress, depression, if you're feeling lonely. It's really a great resource. So check that one out. Virtual Hope Box also has some coping skills. And then you can also like upload pictures that make you feel happy and like different things. You can check that out. And then Breathe to Relax is an app that basically takes you through deep breathing to kind of calm down in a situation where maybe you're angry or anxious or nervous. So those are all free, by the way. So you can download those on your phone and they're free. They're really cool. I highly recommend them. And then the last thing would be if you're looking for a therapist, or you're kind of just wanting to see what kind of therapists there are out there, psychologytoday.com has, it's a directory of different therapists that you can kind of look for based off your zip code on where you live. And then if you want therapy, but you want to use your insurance, the best way to go about that would be to search on Psychology Today and put in the filter for your insurance specifically, or you can actually call your insurance and ask them for a list of providers in your area. So that's kind of those. And then I will also provide my contact information. So if you have more questions, you can definitely reach out to me personally. But also you can ask your teacher and she can reach out to me with a list of questions as well. I'm happy to answer. I hope this was helpful for everybody. And again, if you have any questions, feel free to reach out to me personally or give your teacher a list and I will come back with another video to answer those questions, or I'll just write a document and send them in to you guys. Thank you. Bye.